Good afternoon, everyone. On behalf of OPTOBHARAT, India's optometric community, I warmly welcome all our participants from India and around the world to today's free international educational webinar. I'm Shazia Shabbir, and it is my pleasure to be your moderator for today's session. Today's webinar is on the topic Beyond the 2020 Rule Evidence Based Management of Digital Eye Strain. Our esteemed speaker is Mr. Ankit Sharma. He not only holds a bachelor's degree but also a master's, and he is a PhD scholar as well. He'll share evidence based insights and practical clinical approaches to managing digital eye strain. Before we begin, I'd like to share a few housekeeping instructions. Please keep your microphone muted throughout the session. If you have any questions, kindly post them in the chat box. We'll address them during the Q&A session. Please avoid interrupting the speaker during the presentation. Attendance will be recorded and eligible participants will receive an e-certificate according to OPTOBHARAT's attendance policy. Now, without taking much of your valuable time, it is my privilege to invite our respected speaker, Mr. Ankit Sharma, to deliver today's session. Sir, the virtual stage is all yours.
Hello, good afternoon, everyone.
Good afternoon, sir.
Thank you, ma'am. Thank you, Octavar, for giving me this opportunity, and thank you all community members for joining today's webinar. My name is Ankit Sharma, and today we will discuss beyond the 2020 rule, evidence-based management of digital eye strain. Can we start?
Sure, sir. We can start.
Okay. So, firstly, most of us are familiar with 2020 rule, and many of us routinely recommended it to our patients. However, current evidence shows that digital eye strain is much more complex than accommodative fatigue alone. In this session, we will explore the multiple mechanisms responsible for digital eye strain, review the latest scientific evidence, and discuss a comprehensive evidence-based management approach that can applied in everyday clinical practice. Let's begin by looking the learning objective of today's session. By the end of this session, you should be able to define digital eye strain and understand why it has become such a common clinical problem. We will discuss its pathophysiology, major risk factors, and critically evaluate the 2020 rule. At last, we will review the clinical assessment and evidence-based management strategies that can be applied in daily optometric clinical practices. Before discussing the disease itself, let's understand why this topic is important for today's life. So, digital devices have been an unavoidable part of our daily life, whether we are working, studying, or entertaining ourselves. Screen exposure continues to increase. Studies show that an adult spend approx 6 to 9 hours per day on digital device, while a student often exceeds 8 to 10 hours. As a result, digital eye strain have become one of the leading reasons patient visit optometric clinics and hospitals. So, what exactly is the digital eye strain? Digital eye strain is also called as computer vision syndrome. It refers to a group of ocular and musculoskeletal symptoms that occurs due to prolonged use of digital devices. Ocular symptoms may include dryness, burning sensation, eye fatigue, blurred vision, occasionally double vision. And musculoskeletal symptoms may be headache, neck pain, back pain, shoulder pain due to poor postures. Important point is that digital eye strain affects both the eyes and musculoskeletal system. Now let's see how common this problem has become worldwide. Digital strain is now considered as a global public health concern. Studies shows that prevalence ranging from approx 50 to 90% among digital device users. Higher rates are seen in students, IT professionals, office workers, and healthcare professionals. After the COVID-19 pandemic, increased online work and education further increased screen exposure. That makes digital eye strain even more common. But why does prolonged digital screen use produce these symptoms? Let's understanding the underlying mechanisms. This slide summarizes the multifactorial pathophysiology of digital eye strain. Firstly, prolonged screen use reduce blink rates that cause tear evaporation and leads to dry eye. Second, continuous near work increases accommodative demands that leads to accommodative fatigue. Third, prolonged convergence stress that increase the binocular vision stress. Finally and lastly, poor ergonomics contributes to musculoskeletal symptoms. Those mechanics often occur simultaneously, which is why digital eye strain requires a comprehensive approach. Let's now identify who is at greater risk. Greater risk for digital eye strain can be divided into three categories. First one is individual factors such as increasing age as old people are more prone to digital eye strain, contact lens wearer, dry eye disease, and uncorrected refractive errors. Occupational factors may be prolonged screen exposure, inadequate breaks, multiple monitors, and poor workstation designs. Environmental factors such as air conditioning, low humidity, poor lighting, and screen glaze also contribute significantly. Another important factor is the dramatically increase in screen time in modern life. Today, smartphones are the most frequently used digital device. Many people simultaneously use multiple screens such as laptops, tablets, mobile phone, computers. Viewing distance are become shorter, that increased accommodative demands, continuous near work without sufficient breaks, excessive stress on the visual system. To reduce this stress, one of the most commonly recommended strategy is 20-20-20 rule. The 20-20-20 rule recommends looking at an object approx 20 feet away from 20 seconds after every 20 minutes of near work. The aim is to relax accommodation, reduce accommodative fatigue, and encourage blinking. It is simple, easy to remember, and costs nothing. For these reasons, it has become one of the most popular recommendations worldwide. Rajesh. Then we have scientific evidence behind the 20-20-20 rule. Some research studies suggest that regular visual breaks can reduce subjective eye strain, improves comfort, decrease accommodative fatigue, and blinking also tends to increase during these breaks. That helps in maintaining tear film stability. However, most studies shows improvement in symptoms rather than completely eliminating the digital eye strain. While the 20-20 rule is beneficial, it should be viewed as only one component of a broader management strategy. This brings us to the most important question of today's presentation. Why is 20-20 rule is not enough for the management of digital eye strain? As we know, 20-20 rule is widely recommended, but it addresses only one aspect of digital eye strain, and digital eye strain is multifactorial condition. Many patients continue to experience symptoms because the underlying cause may be dry eye disease, uncorrected refractive error, binocular vision dysfunction, accommodative disorders, poor ergonomics, or environmental factors. Therefore, simply advising patients to take break is often insufficient. Our goal as clinicians is to identify the root cause and provide individualized treatment. So, what should comprehensive management include? A. comprehensive management plan begins with accurate refraction because even small refractive error can increase visual fatigue. Next, binocular vision and accommodation should be evaluated to detect any functional abnormalities. We should also assess the ocular surface for dry eye disease and meibomian gland dysfunction. At last, ergonomic advice, lifestyle modification, and patient education should be included. The best results comes from combining these strategies rather than relying on a single intervention. Let's begin with one of the most common contributing factor, reduced blinking. When we use digital device, our blink rate decreased from about 15 to 20 blinks per minute to only 5 to 7 minutes per minute. In addition, many blinks becomes incomplete that prevent proper distribution of tear film. This increased tear evaporation, destabilizes the tear film, contributes to meibomian gland dysfunction, and eventually causes dry eye symptoms such as burning, irritation, fluctuating vision, and many more. This is one of the main reasons why patient complains of dryness after prolonged screen use. Another important mechanism is accommodative and near vision stress that caused by prolonged near work. Continuous near work places constant demand on accommodative system. Over a time, patients may develop accommodative insufficiency, accommodative excess, accommodative spasm, or ill-sustained accommodation. These disorders commonly present with blurred vision, headache, eye strain, and difficulty in changing focus from near to distant objects. To identify these problems, we should assess amplitude of accommodation, accommodative facility, NRA, that is negative related accommodation, PRA, positive related accommodation, and then monocular estimation method, retinoscopy. Accommodation work closely with binocular vision. So let's examine the next. Prolonged near work also places significant stress on vergence system. Patient with convergence insufficiency, convergence excess, or decompensated heterophoria may experience headache, double vision, difficulty in reading, reduced concentration, and eye strain. Clinical evaluation should include power test, NPC, near point of convergence, and PFV, fusional vergence test, and vergence facility. Identifying these disorders allows us to provide target vision therapy when appropriate. Another commonly overlooked factor is uncorrected refractive error. Even very small refractive error can significantly increase visual discomfort during prolonged screen use. Uncorrected hypermetropia forces continuous accommodation. Small amounts of astigmatism, reduced imaging clarity, presbyopia increased near vision demands, while outdated spectacle prescription can worsen the symptoms. Therefore, every patient with digital eye strain should undergo a complete refraction before additional treatments are considered. Once refractive errors are identified, optical management becomes an important part of treatment. Management should include comprehensive refraction, computer specific glasses, occupational progressive lenses, and appropriate working distance correction. Then we have ergonomics. Poor workstation designs contributes not only to eye strain but also to neck pain, shoulder pain, and back pain. Monitor should be positioned approximately 50 to 70 centimeters ideally from our eyes. Top of the screen should be slightly below eye level. That allows a down gaze of out about 50 to 20 degrees. Lighting should minimize glares and the chair should provide lumbar support with both feet resting comfortably on the floor. Simple ergonomics adjustments can significantly reduce symptoms. Let's see an ideal workstation looks like. This picture demonstrates the recommended workstation setup. Notice the correct viewing distance, slightly down gaze, proper chair support, and appropriate placement of keyboard and monitor. Small ergonomics changes like improve comfort and reduce stress on both eyes and body. While counseling patient, visual demonstrations are often more effective than verbal instructions alone. Now, let's move on the clinical evaluation of digital eye strain. Evaluation, evaluation of digital eye strain should always follow a systematic approach. Begin with a detailed history examination. Begin with a detailed history examination to understand screen habits, symptoms, occupational demands, break habits, sleep, medications, and symptoms. Next, we have to perform a comprehensive eye examination that includes visual acuity, refraction, binocular vision assessment, accommodation testing, and ocular surface evaluation. Standardized questionnaires such as computer vision syndrome questionnaire, ocular surface disease, and CVSS 17 questionnaire can help quantify symptoms severity and monitor treatment outcomes. At last, management should be individualized according to their underlying cause and identifying during examination. Next, we will look at the importance of patient history, standardized questionnaires, clinical examinations, dry eye evaluation, and multifactorial treatment strategies. Before performing any clinical test, a detailed patient history should be examined. Ask about the average daily screen time, type of device used, whether the patient used one or multiple screens. Also inquire about viewing distance, break habits, contact lens wearing, existing spectacle prescriptions, any medications, any systemic disease such as diabetes, hypertension, thyroid, any heart related disease, and many more. Understanding the patient's work environment, including lighting, air conditioning, and humidity, often provides valuable clues about the causes of symptoms. A throughout history frequently guides us towards the corrective diagnosis even before examination begins. To objectively measure symptoms, standardized questionnaire can be useful. Computer vision syndrome questionnaire measures both the frequency and intensity of symptoms. It is widely used in research. Ocular Surface Disease Index (OSDI) evaluates the severity of dry eye and its impact on daily activities. CVSS 17 questionnaire focus on both visual and musculoskeletal symptoms, that making it especially useful in occupational settings. These questionnaires not only help during diagnosis but also valuable for monitoring treatment outcomes over the time. After history and symptoms assessment, next step is a comprehensive clinical examination. A complete examination should assess all components contributing to digital eye strain, begin with visual acuity testing, followed by objective and subjective reflection. After that, we have to evaluate binocular vision by using cover test, near point of convergence, and fusional convergence testing. After that, accommodation should be assessed using amplitude of accommodation, accommodative facility, negative related accommodation, positive related accommodation, and monocular estimation method retinoscopy. This systematic approach helps in identify the specific mechanisms that is responsible for patient symptoms. One of the most common abnormalities detecting during examination is dry eye syndrome or dry eye disease. Dry eye is one of the leading contributors to the digital eye strain. Evaluation of dry eye includes tear breakup time test, non-invasive tear breakup time test to assess tear film stability, Surma test for tear production, tear meniscus height, fluorescein and leishman green staining for occult surface damage, and myobin gland evaluation. Management begins with the patient education, encouraging complete blinking and proper hydration. Artificial tears, warm compression, lid hygiene, and treatment of myobian gland dysfunction are commonly recommended. Most advanced cases may require prescription of anti-inflammatory therapy. Dry eye treatment is only one part of the comprehensive management plan, but as we know, digital eye strain is a multifactorial approach. So there is no single treatment that works for every patient with digital eye strain. Management should combine accurate refractive correction, dry eye therapy, binocular vision management, ergonomic advice, behavioral modification, patient education, and regular follow-up. Each patient presents with a different combination of contributing factors. Therefore, treatment should always be individualized rather than using a one small fits all approach. Let's now discuss the role of optical correction in greater detail. Optical management plays an important role in reducing visual fatigue. Update the patient's refractive correction whether necessary. Computer specific glasses or occupational progressive lenses can improve intermediate vision and encounter a better working posture. Anti-reflective coatings may also reducing disturbing reflections and improve visual comfort. Prescription should always match the patient's actual working distance. Along with the optical correction, healthy lifestyle and behavior strategies are equally important. Patient, patient education is one of the most effective long-term interventions. Encourage regular visual breaks by using 20-20-20 rule, frequent complete blinking, adequate sleep, hydration, outdoor activities, and limited unnecessary screen time. Technologies can also help, such as break reminder applications, screen time monitoring tools, and night mode settings that encourage healthier digital habits. These simple behavioral change often produce noticeable improvements in symptoms. One, one common questions from patient concerns blue light blocking glasses. Blue light filtering lenses have become increasingly popular. However, current scientific evidence does not show convincing benefits in reducing digital eye strain when compared with standard clear glasses. Similarly, there is no strong evidence that these lenses improve visual comfort. Some studies suggest that possible benefits for sleep when we used before bedtime, but the evidence remains limited. Therefore, blue light glasses should not replace evidence based management strategies. Looking ahead, technology itself may become a part of the solution. Future management of digital eye strain is likely to become more technology driven. AI may assist in symptom screening and risk reduction. Teleoptometry can improve access to care, while smartphone applications may monitor blinking and reminder users to take breaks. Wearable devices can track posture and screen habits, allowing earlier intervention. These interventions have the potential to make digital eye care more personalized and proactive. Then we have research opportunities such as personalized digitalized train management, machine based learning to predict symptom risk, long term effects of longer digital device exposure, and integration of AI into routine optometric practice. To understand how these concepts apply in practice, let's, let's discuss this clinical case. This case involves a 28 years old software engineer that presenting with eye strain, dryness, intermittent blurred vision, and headache after longer screen use. Examination revealed mild uncorrected astigmatism, reduced blink rate, A tear breakup time test of 6 seconds, A recedes near point of convergence, and moderate meibomian gland dysfunction. This is a classic example of multifactorial digital eye strain. Notice that patient symptoms cannot be explained by a single cause. Multiple contributing factors requires a comprehensive management plan. Let's now review how we will manage this patient by using evidence-based approach. This patient has multiple contributing factors, so treatment must address each one individually. Firstly, we will update the spectacle correction and recommend an anti-reflective coating to reduce reflections from the screen. Second, we will treat the ocular surface with preservative-free artificial tears, warm compressions, lead hygienes, and blink awareness training. Because the patient also has a convergence insufficiency, so convergence exercise should be prescribed. At last, ergonomic modifications such as maintaining a 60 centimeter viewing distance, reducing glares, and following the 2020 rule are advised. This case elaborates that successful management requires a personalized, evidence based approach rather than relying on a single intervention. Before we conclude, let's summarize the key message from today's session. Firstly, digital eye strain is one of the most common visual complaint in the digital era. Secondly, it is the multifactorial condition that involves ocular surface disease, accommodation demands, binocular vision dysfunction, uncorrected effective error status, and ergonomic patterns. Third, 2020 rule is helpful, but it should never be considered as the complete treatment. At last, every patient deserves a comprehensive assessment and individualized management plans. These principles are strongly supported by current scientific literatures. Finally, I would like to say thank you all for your attention and participation. I hope today's session has provided a practical understanding of digitalized train and reinforced the importance of looking beyond the traditional 2020 rule. As a eye care professional, our role is not only to relieve symptoms but also to identifying the underlying cause and provide personalized evidence-based care and treatment. Now, I I will be now happy to answer any questions.
Thank you so much, sir. Thank you so much. I can say, I think I can say for everyone that the session was truly knowledgeable, and we really appreciate your valuable insights. It's time for the Q&A session now. Participants who have questions, please type them in the chat box. I'll read them one by one. So I think we already have our very first question. Sir, are you ready?
Yes, ma'am.
Okay, okay. So the very first question we have is, how can tinted lenses like yellow or FL41 lenses help to reduce digital eye strain in symptomatic office workers?
Like ma'am, tinted lenses are mostly worked for the people who are working outside the outdoor workstations, like as someone who is working in sunlight and outdoor related work. But anti-reflective coatings are most commonly used in official workers such as IT professional students, and as we already discussed, blue light glasses that are not evidence-based treatment for the digital eye strain.
Okay, okay, okay. I think uh we have another question. Some doctors say blue cuts are not important, only loss many why. Fatma, can you please rephrase your question and then send it again? I'm taking another question. Sir, I need to ask one more important thing about the dark and light mode brightness of the mobile phone and laptops. Should we advise light mode or high brightness, or dark mode or dim brightness of the screens? I'm always confused about.
Like
I'm
when
always confused about the brightness of the screens.
dark light or dim light should not be advised, ma'am, uh, because it enables pupil. Just give me 1 second.
Sure, sure.
Because dim light makes our eyes work harder to see clearly, and it can increase eye strain and visual fatigue. It may cause headache or discomfort during longer reading and screen use. Contrast between a bright screen and dark room can make the eyes feel more tired.
Okay, okay, okay. I think we're going to take one last question. The question is, some doctors advise that blue cut lenses are not important. Why is that so?
Because ma'am, blue cut glasses have not such a mm, true evidence that they are decreasing or slowing the progression of digital eye strain.
Okay, yeah, that makes sense. We need to have some sort of scientific evidence to back it up, right?
Yes, ma'am.
Okay, okay. Before I close this, we are taking just one last question. So, can you give your opinion on how a research on conventional and tinted lenses will help to reduce digital eye strain in office workers?
Mm, can you repeat it, ma'am?
Sure, sure, sure. The attendee wants your opinion on how a
Hmm.
research on conventional and tinted lenses will help to reduce digital eye strain in office workers.
Okay. Tinted glasses are not routinely recommended for reducing digital eye strain. Tinted glasses are usually recommended for people who are working in outdoor activities and engaging in field expertisement, or some people find lightly tinted lenses reduce discomfort from glares or light sensitivity, especially if they have migraines or photophobia. There is no strong evidence that tinted lenses or blue light blocking glasses that reduce the symptoms of digital eye strain in general population. Better sport strategies may include regular breaks and optimizes screen ergonomics rather than tinted glasses.
Okay, sir. Okay, okay. Uh, there is another question that I have in my mind. It's given by an attendee. In single vision lenses, we are having ISIL lenses from SLR to treat the patient with digital eye strain. Do we have any option in progressive lenses to relax the eye strain?
Mm, actually, only lenses are not appropriate treatment for digital eye strain. As we already discussed, it makes sense, like we have to evaluate binocular vision abnormalities, we have to evaluate accommodation related and ergonomics related factors, and then all contributes to the management of digital eye strain. We cannot depend on a single factor that lenses can correct digital eye strain.
Correct, correct. I mean, we cannot rely completely on, we cannot just say na, that there's only one particular treatment for this
Yes,
cause,
yes,
like the cause of
right,
eye strain, right?
right, man.
Okay, okay. So, as we come to the end of today's webinar, I would like to express our heartfelt gratitude to our speaker, Mr. Ankit Sharma, for sharing his expertise with us. I also sincerely thank all our participants from different parts of the world for joining today's session and making it a success. Thank you so much to each one of you, and thank you so much, sir, as well, for all answering all the questions for the session as well. Please do not forget to follow OptoBharat on our social media platforms to stay updated about upcoming webinars, educational events, and learning opportunities. Thank you once again. Have a wonderful day. Stay safe and keep learning. Thank you. Bye bye, guys.
Thank you all. Bye.
Thank you, ma'am.